Hi, my name is Patti Young, and I live in Maryville, Tennessee, which is East Tennessee next to the Smoky Mountains. I have a TMS story that I guess has scanned my entire life. I've been in chronic pain pretty much my whole life, most of the time not realizing that it was caused by emotional issues. I thought they were all physical. It started, when I was a kid with migraine headaches, and then lots of back problems, stomach issues. I even had what I thought was a major hip issue, and was planning to have surgery, even though the surgeon said that my hips looked good, but that maybe I had a mild labral tear that was making me have so much inflammation I needed surgery. Luckily, I did not have that surgery, but my story is as follows. My name is Patti, and I'm here to tell my TMS story. I have had a lot of help recovering and getting my life back. One of the biggest helps was this book by Steve Ozanich, The Great Pain Deception. Also, I do want to mention, and if I forget to mention it again, what really put me on the road to healing was Steve Ozanich's Audible book called Back Pain, Permanent Healing. Anyway, my story probably starts when I was young. I lived in a very violent situation, in a home with violence and alcoholism, and I was fairly permanently terrified all the time. And when I finally developed anorexia when I was a junior in high school, my mother decided that I was going to die, and she took me to a psychologist, and the psychologist told her that I was actually probably not going to do very well unless she got me out of the home, because my home life was so violent. And so she told me that I could move in with friends in Tennessee, which was, I was living in Indiana at the time and had moved away from my friends in Tennessee. And that within a few weeks, she would leave my stepfather, who was the one who was causing all the problems, and we would move to Tennessee together and everything would be fine. Well, to make a long story short, she abandoned me. She never came to get me. She lived in Indiana, and I was in Tennessee with friends, and I had no place to live. And so for my junior year, I lived with friends. I ended up being between my junior and senior year, I had no place to live. I lived in my car until a family in my hometown heard that I was living in my car, and they actually took me in for a year, and it was a great year. When I graduated high school, I felt invincible because I was away. I was on my own. Ended up going to University of Florida for a while, and I felt like I was doing very well. I ended up getting kicked out of the dormitory because I adopted a puppy, and I couldn't keep the puppy, and I was out of the dorm, and so my boyfriend at the time ended up taking this puppy and moved with it back to Tennessee and left me feeling abandoned again and depressed. So at the end of my freshman year in college, I moved back to Tennessee and got my dog back. At that time, my mother didn't like who I was dating, and who previously had sent me money, cut me off from everything. And so I had enough for tuition. I started working and going to school, but I was traumatized again. During that time, I was 22 years old. I had loaned a portable typewriter, which at the time those typewriters were really heavy. They weren't really portable. I went to pick it up to put it in my car, and I felt my back go, like an excruciating pain in my lower back. I was able to get into my car. I was able to get back to my apartment. But for the next 2 weeks, I literally could barely stand up. I was incapacitated. I couldn't even have anybody sit on the bed with me or touch me. It did progressively get better, but over the next year, about once a month or once every 6 weeks, I would go to lean over to pick something up, and my back would go out again. During my junior year in college at University of Tennessee, I was actually felt like I was doing pretty well, even though my back would go out occasionally. I had started competing in some hunter jumper and some eventing. I was riding pretty much upper level equestrian sports. I was hiking. I had tried hand gliding. I actually in some ways felt like I was doing really well. I felt brave, and I would go on these major backpacking trips. I would carry heavy packs. I thought I was doing well. And of course, every once in a while, my back would go out. I never, at that time, related that to anything stressful that was going on at the time. However, one day in my junior year, I was driving with a friend to the Smoky Mountains to go hiking, and my right leg started hurting really, really bad. Like, I thought it was a muscle because I was also a runner. I played racquetball. I was so incredibly physically active. I was training for a triathlon. I was riding my bike a lot. So I thought it was a muscle, and I ended up pulling over and getting out of the car and tried to stretch my leg out, and nothing helped. It was getting worse. I got back in the car, thought maybe, if I drove a little bit longer, it would work its way out. And I finally looked at my friend and I said, I'm in excruciating pain. I don't know what this is. It's my leg, it's my calf muscle, it's like cramping. And I don't think I can go. So we turned around and we went back home. For the next few weeks, it got worse. I was in pain 24 hours a day. I couldn't sleep. I would try to go running. I started losing function, some function in that right leg. I started dragging my leg. Finally, one day I was actually in class, and the pain was so horrendous that I started crying. And I got up and I went and got my car. I drove to the Knoxville Orthopedic Clinic, and I did not have an appointment. I went in and I started crying, and I said, somebody help me. It took a while, but a doctor did come, and they took x-rays, and he looked at me and he said, we're admitting you into the hospital immediately. You might need surgery. And so they did surgery, and they did a laminectomy on me, and the pain was gone. I became unbelievably active, and really life went pretty well for years. Occasionally, I'd pull a muscle on my back, but nothing like before, and I thought I was cured. So now I want to back up to the type of personality that I developed because of my childhood. In everything I did, because of my being treated poorly as a child, I tried to get attention by being the absolute best person I can be, have the best handwriting, make straight A's, clean my room, meticulously clean everything, take care of everything that I owned. I became unequivocally a perfectionist. And because of that, once I got out of college, I became a teacher, and I became what I thought to be the best teacher I could possibly be. I started bringing kids home with me, taking trips with kids in the summer through a travel program. I really became very, very, very busy. I ended up starting my own equestrian program, having my own farm, having my own horses, schooling horses, teaching kids riding lessons, working all day at a regular teaching job. I kept my house immaculate, kept my barn immaculate, organized everything, and really thought that I was doing what a good person does, is take care of everything and do the very best you can at everything. I cooked all the time. I ended up getting married, having 2 beautiful children, wanted to be the best mother I could be, which obviously meant that every meal had to be home cooked. And of course, at the same time, I'm still teaching, and I'm still teaching riding lessons, and I'm still taking care of horses, and still keeping my house immaculate. And that went on for a time, well, really forever, until my back started going out again. And my back would go out every time something big was coming up. It seemed like it'd be like I have a horse camp with 20 kids and 10 staff members, and I'd be so busy preparing, my back would go out. I'd have an art show that I was getting ready to put on with my kids at school, my back would go out. I mean, it could be anything. I could barely lean over, my back would go out. And when it went out, of course, I became terrified because I knew that it was going to be out for weeks, at least. And when I talk about it going out, I mean not being able to walk, needing a cane, but it would eventually get better. And I thought it was always because of that surgery at L5-S1, and the diagnosis is that I had from doctors that I had degenerative disc disease, that my other disc didn't look good, that I even had, one place that wasn't nerve involvement, but that was possibly getting close to being close to my nerve. And so my MRI was terrifying, or MRIs. And I was pretty much afraid. I started getting to where I was afraid to do all the things that I would normally do, but it wasn't too bad until I retired. So now I'm 63 years old. I retired 3.5 years ago. When I retired, all of a sudden, I wasn't getting up at 5 o'clock in the morning and taking care of the horses and going to school and spending all day at school and doing everything that I needed to do to be a perfect teacher, and coming home and having about 15 minutes to get out and get the horses in so that I could teach my riding lessons. All of a sudden, I had more time on my hands. And I wasn't busy 24/7. And I'm not sure whether I had more time to think about my life, how my mother had abandoned me when I was young, whether I felt, terrified not to be so busy. But after I retired, basically, my back was out all the time. I mean, I had a few days where I felt like I could do something, but my life changed. I could no longer run. I could no longer hike. Every once in a while, I felt like I could ride my bike, but it felt like it hurt my back. Then I felt like I couldn't take my bike anywhere because I couldn't obviously lift anything, because anytime I would try to lift anything, my back would spasm, and then I would be in bed for, a week. And so, I had to buy a special rack for my car so that because I couldn't pick my bike up, I had to use a ramp. And my back continued to even get worse, to where it wasn't like I couldn't just ride my bike. I couldn't cook because if I stood up for too long, my back would spasm. I couldn't sit at the table for long because my back would spasm. I started going back to doctors. I started using a TENS unit, sometimes at first, when it was critical, and then I would wear a TENS unit not 24 hours a day. I took it off right before I went to bed, and then when I went to bed, I had to be on a heating pad because the pain was so bad. I couldn't feed the dogs. I couldn't lean over to get their bowls. I could not feed the cats. I could not brush a horse. I could not ride a horse for sure. I could not do barn work. And what had happened was, I have this equestrian business. I ended up having to hire a full-time staff to put the hay out, to brush the horses, to actually teach the lessons. I couldn't even teach the riding lessons anymore. I was paying a lot of money out in wages, and pretty much had creams, Tylenol, every once in a while a hydrocodone. Every doctor had a different, diagnosis basically, or more of the same, where more surgery would help. Basically, last Christmas, 2019 at Christmas, I was pretty much incapacitated, and my son, who is 27, came home, and he looked at me and said, "What has happened to you?" And I just didn't know. I didn't know whether the last diagnosis of my SI joints being inflamed had just put me in a position where I couldn't do anything anymore. And I cried, and I cried, and I cried. For the first time, I just let it all out, that my life was never going to be the same. And I didn't really even know if I wanted to go on anymore, and came from a person that had always been so optimistic and such a go-getter, that when my son left, I was on my computer, and I was going to give it one more try to see if there was something I could do besides major surgery. And I was looking up having a TENS unit implanted in my spinal column, so that I could have like a remote, and I wouldn't have to carry it on the outside anymore. I'd known someone who had one and had liked it. And while I was looking for that, and I was Googling for that, I saw something about TMS and back pain. And I read it, and it talked about Dr. Sarno, and I started reading about what TMS was or is, and what kind of person gets it, and I was shocked, because I had every personality trait. But I thought, well, I see that this is, maybe a possibility, but mine is so structural. I mean, look at my MRIs. My MRIs are horrific. And every time I bend over, something goes out. It has to be my back. My back is a mess. And I visualize my back as being a mess. But I was intrigued by Dr. Sarno's book, and I decided that he talked about therapy. He talked about abandonment and childhood issues, which I obviously had. And so I called somebody in my group. I have a wonderful internist who's an alternative medicine person, mind-body person. And she recommended that I see Annie, the psychologist. And so I made an appointment, and I went into her office, and I barely was walking. I sat down gingerly because my back hurt, and told her what was going on. and told her, I said, I don't know if this applies to me, but I saw on the internet where there was a doctor named Dr. Sarno who helped people and helped them get out of pain, out of chronic pain, which at this point, I've basically been in pain for 3 years every day. And she got up off of her chair and she walked to her bookcase and she picked up Dr. Sarno's book and she handed it to me and she said, "You need to read this." Well, I did read it. I read the whole book. And I was definitely on the beginning of a journey of possibly healing. But in the back of my mind, I still didn't completely believe it. So as I started looking the other things to read, I started finding YouTube videos of people who they were emphatic that this book was the thing that really helped them. So I ordered Steve Ozanich's book, The Great Pain Deception. I also ordered some other books by other people and some workbooks by some other doctors. I ended up finding an app called the Curable app, which on one of their videos, there was a doctor named Dr. Strax who was a mind-body person and who also, he gave his story of healing. I ended up making a video appointment with Dr. Strax and told him that I thought it was possible that I had TMS and he talked to me for a long time. I had written a lot for him to look at about my childhood and my personality and everything. And he thought it was really possible, very, very possible, that all the pain that I was feeling was TMS. So at this point, I'm feeling a little better. I'm doing a few little things, but I still have a lot of pain, a lot of aching, different pains everywhere. It would start on one side and then it would go on the other side. Sometimes I would have sciatica. I would have aching, sometimes my upper back. I was trying to walk. So basically, what happened was I do like to listen to audiobooks, and I felt like in the car I was scared a lot, even though I was, thinking that I might have TMS. I was in a lot of perpetual fear that anything I did, if I didn't have my heating, if my car seats weren't heated, if I didn't have my TENS unit on, God forbid I shouldn't have my TENS unit on, that I would, get a horrible pain and then I would be stricken and not be able to walk. That I found Steve Ozanich's, a different book, not this book, but a book called Back Pain, Permanent Healing on Audible. I put it on my phone and I started listening to it in my car. And that basically changed my life. I enjoyed reading this book. I enjoyed the other books that I read and felt like they helped me. Nothing helped me like listening to Steve Ozanich's book, Back Pain, Permanent Healing. I don't know whether it was because somebody was talking to me, but literally, the things that he told me, he's so emphatic in the audio book that if your back hurts, it's probably TMS. That even if your MRI's bad, it's probably TMS. That if you had a pretty troubled childhood, or you've had stressors in your life, or you have a perfectionist personality, you probably have TMS. I mean, he was truly emphatic. I mean, nothing spoke to me like his audiobook. I started screaming in my car. I cried in my car. I listened to it over and over. I kept going back to other sections and listening again and crying again. because I couldn't believe how on target he was to me. And then I started healing. I did the exercises that people say to do. I started journaling. I started learning to meditate. But I did it wholeheartedly with the knowledge, with the absolute certainty at this point, because of listening to that audiobook, that yes, indeed, I have TMS. And it's nothing but TMS. Within a few weeks, I was so much better. I started feeding the chickens by myself. For the first time, in, I don't know, years, 3 years, I got out of bed and didn't feel like I was so stiff that I couldn't move. I was terrified to move before. I was getting out of bed. I leaned over and picked up the dog food bowls. I won't say that it was perfect all the time. I would have days every once in a while where I would get scared, and then I just had to regroup and reconvince myself, especially if a pain moved, which is so TMS, because my lower back seemed to get better and better, and my lower back was always my biggest problem. If something weirded out, like in my upper back, I'd think, oh no, that's something else. And then I would go back, I'd get my book. Definitely my back pain permanent healing. I would listen to it again and go, no, there's nothing wrong with my back. And you know what? There really isn't anything wrong with my back. So all of the problems that I had, I'm lucky to have found these resources. I'm so grateful to Steve. I'm honored that in his email he recommended that I watch the Healing Wall of Victory, which I have watched all of them. And so this was just going to be my attempt to share my story, my TMS story. And so again, I thank all the people that helped me, definitely Dr. Sarno and Dr. Strax for sure. But truly for me, and I don't know how it is for other people because everybody's different, I highly recommend getting the audio book of Steve Ozanich's Back Pain Permanent Healing, because he talks to you. And that is really what put me on the road to recovery. And I am now back taking care of the horses completely by myself. Used to have a special pillow to drive the gator, and even then it still hurt. I can load the hay up by myself. I can pick it up. I can feed the chickens and lean over and clean their water. I can go gather eggs all by myself, which is a joy. I can lean over and feed the cats. I can lean over and feed the dogs. I have to lean over to get the feed out of the feed bins, and then of course I have to rake the barn hall and bring the horses in twice a day for their meals and put them back out. I'm constantly on the move. Running a small horse farm is a lot of work. I had hired it all out to other people and would look out my window or stumble down to the barn the best that I could, and felt so sad that I couldn't do anything. And even sometimes when I would try to do something, my staff would say, Patti, hey, don't do that. You'll hurt your back. But now I can do it all. I can get on a horse and I can ride away. Part of what kept me in so much pain was the fear of having the pain. And that fear was dangerous. I'm not afraid. And if I do get afraid, I just go back to my resources. Good luck to everyone out there with chronic pain. But there is a cure, and you can do it. You can do it.